Good day, I am Senator Charlie Dumario from BSN 1D of Holy Trinity University, Group 14 for RLT. And for today's return demonstration video, I'm going to be performing oral care for conscious and unconscious clients. So with further ado, let's begin with the procedure. Good morning, ma'am. I am Senator Charlie Dumario and I will be your student nurse for today. Ma'am, for clarification, can you state your name for me?
I am Missing Tunde Rabidoro.
How about your age, ma'am?
I'm 20, born on the 2nd day of January, year 2002.
Okay, thank you, ma'am. So, ma'am, for today, I'm gonna be performing oral care on you. Would that be okay with you, ma'am?
Yes.
Okay. So, after identifying and explaining the procedure to the client, I will have to prepare all the equipments required. And close all the doors and curtains. And after that, I'm going to prepare the mouth solution. So, assuming that I have already performed medical hand washing, I will be performing hand hygiene. And wear my disposable gloves. So now, ma'am, I'm gonna assist you in the easy fine position, okay? So, I'm from 1 to 3, ma'am. Okay, thank you. So, after assisting my client, I will be inspecting her oral cavity using this tongue depressor and pen light. So, ma'am, can you open up your mouth for me? Okay. So, based on my observation, I didn't see any abnormalities like swelling. So, I will have to dispose this tongue depressor. So after that, I'm going to place this face towel over the client's chest. And this kidney tray here. Okay. And now I will assist the client to brush her teeth. So I will now put some toothpaste on the client's toothbrush. Okay. So ma'am, I will now assist you in this toothbrush for me. So ma'am, you can brush your teeth at a 45 degrees angle, starting from the inner to outer. Okay. Now, ma'am, you can brush your tongue starting from the inner to the outer part po. Okay. So now, I will just prepare your tap water to rinse your mouth, okay? Let me assist you with that. So after that, I will clean her toothbrush by rinsing it with clean water on the glass. And put it in its proper place. Now, I will assist the client to her comfortable position. But before that, I will remove her towel and wipe his mouth. Now I will assist the client to her normal position. So ma'am, you can now lay back again. Okay. Thank you. And now I will put on some lubricant on her lips for moisturization. So ma'am, I will just put this lip balm on your lips, okay? Okay. And now, okay. So after putting some lip balm on the client's lips, I will now replace all the equipment that I have used with this procedure. And now I will have to discard the dirt or the trash that I've compiled in this trash can. And after that, I will remove my gloves. Wash my hand and perform hand hygiene. And after performing hand hygiene, I will have to document the procedure with my signature. And after documenting it, I will have to report the procedure to the senior staff for recommendation. So, with further ado, let's move on to the unconscious oral care. Good morning, ma'am. I am Sari Jollibee Dumaling and I will be your nurse for today. So, ma'am, for identification, I will have to see your armband po. Okay? Okay, so Miss Kassen, 20 years old. Okay, so, ma'am, for today, I'm gonna be conducting an unconscious oral care on you. Would that be okay with you? So, I assume, okay. So, after checking the client's identity and explaining the procedure to her, I will have to close the windows and curtains and doors. So now I will have to prepare all the equipment required for this procedure. Okay. So as you can see, the client is unconscious, so I will be using tap water with this procedure. So after that, I'm gonna have to prepare the cotton balls by soaking it with tap water because the client is unconscious, so we cannot be able to use a solution. After preparing the cotton balls, I will now be wearing my disposable gloves. After performing hand hygiene. So let's assume I have already performed medical hand washing, so it's okay for me to proceed with hand hygiene. And after I wore my disposable gloves, I will now be placing the rubber sheet on the client's chest. And place this kidney tray over here. And place the client in a position towards me. So now, and I will place this face towel over the kidney tray. And after that, I will be inspecting the client's mouth for any abnormalities. So always remember that you should never use your fingers to open the client's mouth. So instead, I will use this tongue depressor. Ayan. And I'm gonna use this nozzle. And now I'm gonna discard this tongue depressor. So based on my observation, there are no any presence of abnormalities underlying on the client's mouth. Now I will have to clean the client's teeth, so I will open her mouth and put this nozzle on her mouth and start cleaning her teeth, starting from her inner part. Okay, so I will just wipe this one. Okay. 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 So now I will have to dispose this cotton ball and tongue depressor again. And remove the nozzle. And I'm just gonna place this nozzle here to suction the client's mouth. Okay. So I'm gonna use this tap water to rinse the client's mouth. So I will fill my syringe. Okay. So okay, I'm gonna suction the client's mouth. Okay. And suction it and place the residue on the kidney tray. Okay. Okay. So now I will remove the nozzle and wipe the client's mouth. So after discarding the cotton balls and tongue depressor that I have used to wash the client's teeth, I will now be cleaning the client's tongue. So I'm going to use this tongue depressor to open the client's mouth. Okay. So I'm gonna clean the client's mouth starting from the inner part to the outer part. Okay. And I'm just gonna discard this. And again, I'm gonna rinse it using this syringe I have here in my hand. Using this tap water. Okay now. Okay. 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 And after that, I will now wipe the client's mouth and confirm the condition of the client's mouth. So based on my observation, the client's condition of her mouth is great, and I have not seen any abnormalities again, as I have done with my procedure. And after that, I will remove this towel and kidney tray. And reposition the client to her original position. Now, I'm going to have to position her. Okay. After positioning the client, I will now have to replace all the equipment to its proper place. And discard all dirt. And after removing the dirt, I will now have to remove my disposable gloves and wash my hands, perform hand hygiene, and document the procedure. And after documenting the procedure, I will now have to report the procedure to the senior staff for any recommendation. So that ends our procedure for today. Thank you.